Okay. All right. Thanks for sharing, everybody. We are very excited to have Dr. Titchiner here today. She is a neonatologist who is double board certified in general pediatrics and neonatal-perinatal medicine, and she's going to be sharing her insight and expertise about caring for babies with all of us. Before she starts, I want to remind everybody that even though Dr. Titchiner is a neonatologist, she is not your doctor, and she is not providing any direct medical advice today. She's here to share her personal experience with us. So please direct any of your own personal medical questions to your own providers. All right, Dr. Titchiner, I will let you get started.
Thank you so much for having me. I will start off by saying Andy knows I just finished a 26-hour call, so forgive me if I stumble a little bit. Just to give you a little bit introduction of who I am originally from Brazil and moved here when I was 8 years old. And have been here in the States. We live in Charlotte, but I trained in Stony Brook in New York as a pediatrician, and then at Duke University in Durham for my fellowship, where I got the opportunity to treat several patients with both just small omphalocele as well as very large giant omphalocele. I have twin girls, and they were NICU babies as well. It was a very urgent emergent delivery due to some complications, and they were in the NICU for a very short amount of time. But it has drastically changed the way that I practice and the way that I communicate with families, because I got a very small idea of what it is to walk into a NICU and walk out without your kids and have to do that day after day, and get disappointed about, hey, we're going home, and hey, we're not going home. And um, it was a very difficult experience, but I am so grateful that I have that and I am able to share that with my patients. Um, I will also say this is a topic that's very dear to my heart. And I had the privilege of treating Grace, as well as the little one, Dimitrik. And it's still emotional for me. And so please excuse me if I break into tears. But it is something that has really touched my heart and changed who I am as a physician. So I always like to start, any prenatal consult that I'm doing with families in addressing the fact that the minute you found out your baby has a diagnosis, and that's whether it is omphalocele or congenital heart, or a defect of any form, that a sort of mourning process begins, because it is a mourning process in terms of the idea of the pregnancy you imagined, or the idea of the birth plan you had, or whatever that might be. And it's something that continues throughout your pregnancy. So it's always very hard. And I think as physicians, we have to be very aware when we're talking to families, because it is very difficult. To us, it might be something that we see more often than we would like, but in reality, it's your whole world. And so I always challenge my coworkers to talk with grace and with patience, because it is a lot. And it's, instead of having a pregnancy that's filled with, celebrating everything, that gets dulled a little, because you're worried every single second. What does this mean? What is it going to look like? When are we going to go home? Especially with omphalocele, it's recognizing that though some babies might not need a surgical intervention, others will. And then knowing, especially with the giant omphalocele, dependent on what organs are in there, there's huge risks associated, and usually long-term stays. So it is a very complex thing. So I just want to acknowledge that right now, that I know every single one of you, whether you're pregnant right now or you have delivered an baby, that I see you, and I know that this is very difficult. So please have some grace upon yourselves. It is okay to ask doctors the same questions over and over and over again. a lot of the information we share with you guys is trauma-based information, right? And so you are only grasping about 20% of what we're saying. And in order for you to become an advocate for your baby, you have to understand that language. And in the NICU, we say it's almost like we're speaking a foreign language. There's so many new words, so many new medications. And I think the biggest challenge we face too is kind of once you enter the NICU world, each unit is set up a little different. But one of the hardest things, and I know I asked Cassie and TJ to share their experience in terms of what were the challenges that they faced, and also as a physician that I see, and that is that every week, some places every 3 days, some places every 24 hours, there's a different physician on. And because omphalocele can be treated so differently, that plan can seem so inconsistent. And I want to recognize in saying that it becomes really difficult sometimes to trust the team you have because it changes so much. And you start asking, who do I trust? Is it this person? Is it this provider? And so again, ask those questions. At the end of the day, it may not seem like right now. At the end of the day, you know your baby best. You have felt them inside of you for as long as you carry them. You know the signs, you know their smile, you know when it's a good day and when it's a bad day. And don't forget that through your journey, because it's easy to forget in the sense that when they're born and it's scary, you're looking to the providers to be that parental role in essence and say, this is what we're going to do for baby A, B, and C. Because a lot of families don't have any medical background. And so somewhat it feels like, yes, I just had a baby, but I am trusting these individuals who I've never seen or never heard to do all the major decisions for my kid. And so I challenge you guys that even through that, that you guys still know your baby best. And I am a big proponent that there is a God-given sense that you get as a mom, as a dad, as a family member of when something's wrong. And it may not be clinical. I may not see any signs like a heart rate change or blood pressures or things we look at, but there's this feeling that you get. And I can't tell you how many times I've had parents say, Danny, I don't know what it is, but I feel it. Can you please just check the hemoglobin, or can you please just check something? And they were right. So please never forget through this journey, you are your baby's best advocate and you know them best, irregardless of what it might feel like. So I always like to prepare families that it can be very scary. And I challenge them to always tour a NICU before you actually have the baby. There are lots of monitors. Depending on the layout of your actual NICU, you might have an individual room, which is really nice, which will allow you to actually spend time with baby and give you privacy. And then there are units like ours here in Charlotte that you do not have individual rooms, unfortunately. And so you are mixed with other babies. And so you have a 22-week infant right next to your full-term baby with a giant omphalocele. You have a baby who's critically ill next to a baby that's stable. And that can be really challenging for parents, but it can also be a really good place to build community. And so that does not take away from the fact that walking in and seeing the monitors or seeing your kid maybe intubated on a ventilator and with the beeping sounds and then the IVs and all that stuff is really overwhelming. So I always challenge parents to, if possible, if your hospital offers a tour, please take a tour, get to know the layout so that it is less of a kind of shock when it comes to walking in, and when it's your kid is a very different feeling. With giant omphalocele or omphalocele in general, there's a huge spectrum. So I've seen very small ones where the omphalocele is actually it almost looks like it's contained within the umbilical vessel. And then I've seen very, very giant ones that have stomach and liver and intestines. Um, that the giant cephaloceles, I'm going to be honest, is always a big challenge, just because of the sheer size of space, that one usually has to heal, before we can kind of send kids home, but also the risk of, because it's an enclosed state, of something getting trapped. And so again, it's us being very, very watchful and mindful, and sometimes getting a lot of images, and watching for subtle signs that there's something going on. And usually we worry more about that when we start, let's say, feeding, and things like that. It's where we really got to watch closely. Um, I have seen babies, again, depending on the size, who have been with us for a couple of weeks, to many, many months. And, unfortunately and fortunately, because we get to build that community with you guys as well. But it is a huge stressor on families, both financially, emotionally, physically. Um, and so the other tidbit I will give you guys is that if your hospital, if there's any way they can help, whether that is by putting you in a hospitality house or the Ronald McDonald House, or offering vouchers for gasoline or whatever it is, irregardless of what path you come or your financial situation, take the help, because it is something that I never want my parents to worry about, is how am I going to come visit my kid, or how am I going to do this, because you already have so much on the table. So if there's any way that we can unburden that, please ask for resources and accept them, because they're there to help out. So don't shy away from that. Um, when The other things I always tell parents is, I am someone who's going to be very transparent, and that has been, it's really hard. And so I always ask parents to have some grace on us as well, because it is very hard to share some of these very scary diagnoses, some of these very scary long-term fears that we have. And in a lot of my experiences, it's very personal, because we've gotten to know you, we've gotten to know your baby. And it's also painful for us to share that information. But I am a firm believer that in order for you to advocate for your baby, you need to have all the information to make the best decision possible. And that looks different for every single family. And that's what I stress. Some families um, face a lot of odds, in terms of challenges that the omphalocele brings to the baby, or concerns we have. Um, and, you know, they can decide to say, yes, we want to move ahead and we want to do everything possible. And for some families, that looks like, I just don't want my baby to suffer. My goal is to take them home and have them have the best life possible. And so again, when you're thinking about the life you imagine for your baby, that's always something important to keep in mind. Um, and so um, physicians should never shy away from those conversations. And if you feel like if you feel like there's something that they're not telling you, um, then call it out, name it out, and say, hey, I just feel like there's something that's very unclear, or hey, I just feel like, is there something that you would like to share with me, even if it's difficult? Um, and challenge them to kind of step up to the plate. It's not always easy, but you have every right to know, so that you can make the best decision for your child. Um, Different things too is, as Ray mentioned, it sounds like your granddaughter also have a heart defect. So there are layers of complication when it comes to omphalocele, because they are associated with so many not GI related abnormalities, such as heart or bladder, or even other intestinal issues. And so the care should always be individualized to your baby. That is a pet peeve of mine when I see other physicians saying, oh, but most babies do A, B, and C. Right. but that's not my baby. And so always challenging them to look, yes, the care is A, B, or C for 99,000 babies. But what about my baby? And challenge them to kind of personalize that care. And that is where, again, there is an art to medicine. Everyone's going to manage it a little bit different. But the point is that we always want to support families, not only in their decisions, but walk them through them so that it is clear. And if there's something unclear, again, I challenge you to just ask those questions and keep asking them. Um, the other thing too is doctors, I say, are also like therapists or like marriage. There is a good fit for everyone. And so if sometimes it can't be helped, right? It's just the rotation of the doctors and stuff like that. But if there is a physician that you feel is just, it's just not connecting, and that's okay, right? Just like every relationship is not going to end up in marriage, or a therapist is just not going to be the right fit. um, Sometimes it just takes speaking out and asking to talk with someone and say, it's not that I don't like that doctor or trust that doctor, or whatever it is. It's just, I don't think it's a good fit for me and my family. And that's okay. And most units are able to kind of accommodate and try to help out in bringing that communication. And a huge part of that is that if your hospital offers is actually we they call it the palliative team or the PAC team. I like to refer to them the quality of life, because that is truly what they're about. It's about looking at the challenges of very complex kids and saying, how can I have them have the best life possible, whether that be 3 days or it be, you know, 18 years when they age out of the pediatric age. And so, if your hospital has a pediatric palliative care team or quality of life team, they oftentimes become a not barrier, but become kind of a middle person between you guys and the physicians or the nurse practitioners. Because I also acknowledge that sometimes it can be hard to talk to the medical team. They also are able to give a lot of guidance of what life looks like outside the NICU, because they follow those kids through the birth, and the whole process with the healing and the surgeries and all that, into, if let's say they go to a step down unit or the pediatric floor, or you get readmitted, you will see that same team through. And they are great about saying, hey, yes, I know this baby. I had them from birth. These are the complications they had, or these are the things they like. And so if they offer that, please use them as a resource. The other thing is also, some units have unit psychologist, which is also really helpful. Just trust me on this. If they have availability for that, please take advantage of it. It is stressful already to be in the NICU, much less with a baby with a complex congenital defect. And having someone to talk to who understands and is trained to talk to families is crucial. So please take advantage of that. And again, the last thing I'll say before I turn it over to you guys is always ask for clarity on things. Because like I mentioned, physicians can change, people can change, the nurse practitioners, you get so many faces. Please ask for clarity and say, the other doctor mentioned this and this. What are your thoughts? Because sometimes we just need to get all on the same page. Some units will offer a one physician for very complicated patients, where that physician is kind of the point person. So even if you may see a different attending on, that is your doctor. And so it kind of becomes, again, another person that's able to say, no, this is the plan we made with the family. And so what can we do to continue and be consistent with that? um yeah, those are kind of the major things I talk with families. Again, I'm here to answer all and any questions. I know I didn't get into the details or the care of seals and stuff like that. I think most of you have read. Oh, please, for the love of God, avoid Googling things. Google is great, but I assure you, I have died many times on Google for my illnesses. They usually show the very extremes of range, and so the pictures you will see are very, very scary. The stories you will hear are very, very scary. This is a great organization, a great group to get really good informative information, but also be weary of groups that on Facebook or Reddit and things like that, because some of that information might not be accurate, or again, might not be accurate for your baby. Um, and so, yes, it's important to be in the know in research, but please ask your physicians or your maternal fetal doctors, where can I go for the best resource? And hopefully they'll be able to point you in the right direction. But yeah, I'm happy to answer any and all questions, and I hope that was helpful.